insured?
Gotta get the system cured.
What do we want?
Healthcare.
When do we want it?
It would end the practice of excluding people because of pre-existing conditions and gender discrimination. Yeah. And it would be the first step to help end big insurance's stranglehold on the healthcare system in America. We are closer than ever to real healthcare reform, and we are making real progress today.
Dr. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. On Saturday night, the vote of the House of Representatives was a historic moment for our nation. Never before, as you know, have we been this close to treating healthcare as a basic human right and providing all Americans with access to the affordable care that they need and deserve. We should thank the 220 courageous legislators, including all members of the Massachusetts delegation, who voted for the bill on Saturday night. We should thank the 220 courageous legislators, including all members of the Massachusetts delegation, who voted for the bill on Saturday night. Thank you. They stood tall in the face of vicious and misleading attacks from vested interests like the health insurance industry and their right-wing allies. Thank you for their support. Now, we must redouble our efforts to ensure that a strong healthcare reform bill, including a public option, is passed in the Senate. Those who stand to lose from healthcare reform and those who simply want to see President Obama fail will not give up without a fight. This will be their last stand. But we are ready to face them. In the words of our president, the arc of history is long, but it bends toward justice.
This reform makes good health care more affordable for our families and businesses and includes the choice of a public health option. We're here today to thank them and to urge them to keep fighting for health care reform and to make sure that we stop the insurance industry abuses, and that we pay for the reform through fair financing and not by taxing higher cost plans.
There are many people who do not have health care coverage. There are some people in our state, not as many as there used to be, who do not have health care coverage, and there are some who increasingly cannot afford it because the costs keep going up, even with our subsidies. The public option has to be a real option. It has to be a good option, and it has to really work. And we should not compromise that. We need to keep working. We will all need to praise our people in Congress and in the Senate for working on this and moving it ahead. And we have to ask them to make sure that we have a solid bill, even if it requires some compromise.
And we in Massachusetts know that much of what was included in that bill is patterned on the success that we've had in Massachusetts, of shared responsibility, of believing that health care is a human right that all must have. Everyone deserves health care in this country, and your health outcome should not depend on your financial income. And we believe that the bill in the House has taken us a tremendous way to enacting true reform in this country.
The attention is shifted now to the Senate. We need everyone here to also place a call to Senator Kerry and our new Senator Kirk and tell them they have to make sure the bill that comes out of the Senate is the bill that we want as well, with a strong public option.
I believe we need to thank our U.S. representatives of Massachusetts for helping enact a historic and important health care reform act for the whole country. My mother passed away in the spring of this year, and we ended up putting her on a plan that was cheap, but unfortunately meant we couldn't have her in a nursing home near my father's home. And so what ended up happening is my father couldn't visit often enough. She got depressed and we couldn't monitor her care well enough, and I think just because of the whole situation in America with the insurances and what they covered, I don't think she was watched carefully enough, and she passed on earlier than I think she would have otherwise. We can make sure every American has affordable health insurance. It's not a big luxury. Every other developed country can do it and does it for less and often with better quality than we can. So it's time for America to step up and do it.
I know there's just so many people out there that haven't been blessed like I've been blessed. So I'm really here for everybody that's having problems, and I know there's a lot, and I don't like it. Well, I've already called my congressmen and my senators. I've been calling them all summer to tell them I support the public option because I think it's so important. It's just ridiculous that the bottom line of companies should be more important than people's health. It makes no sense to me. It's a moral right, it's a human right of everybody to have health insurance.
Move On's goal for today's rally was to mobilize a number of people to try to thank our representatives for the job that they did on Saturday and to keep up the momentum in the Senate. As so many of the speakers today said, it's so important for us to keep the pressure on the Senate in order to make sure we get the bill that we want out of this in the end. We're very, very hopeful now, but honestly, in order for it to happen, we really need to keep the momentum and keep the pressure up. So we're not resting until it's over.
The bill narrowly passed in the House on Saturday with a vote of 220 to 215. Speaker of the House Nancy Pelosi was instrumental in passing this bill and is coming to Cambridge. Stick with WEBN for continued coverage. In Boston, I'm Jennifer Redding for WEBN.